Hey, what's up, everybody? It's Dr. Jason Jones back with another episode of Health Made Easy, and I hope you're having an amazing week. If you're not, we certainly hope that the info that we're going to share today certainly is a blessing for you and helps improve your life in some way, shape, form, or fashion. So, today we're going to be talking about the best treatment options for disc problems. So, the use of non surgical and non drug treatment methods in providing relief from the symptoms of disc issues has been proven super effective time and time again. We know that surgery is risky. We also know it's irreversible and expensive and has a much higher recovery time. It is estimated that over 50% of the population walks around every day with a disc issue, and certainly many of them are super thankful that they actually don't require surgery to fix it. And if a person has, let's say, a disc herniation, the size doesn't really make any difference when it comes to being able to do non-surgical and non-drug treatment methods. You always are going to have an exam done. The patient should always be examined. You don't examine the picture, you examine the patient. So super important. I always say, the patient isn't a symptom. They aren't a condition. They're just a person that has a condition for now. In some cases, surgical treatment of disc issues may be very disappointing for patients who suffer with disc problems because the pain may not be reduced. In other cases, the pain may return or even become worse, which may cause weakness in other areas of the spine. I know at some point, and this may have changed, it may have improved over time. I'm not 100% sure at this time, but spinal surgery had about an 18 to about a 32% success rate, but I'm not really sure what they were calling success. Was that completely, elimination of the pain? And certainly some people have had that with their spinal surgeries. However, other ones have been made worse as a result of that. Natural treatment options for disc problems are super effective for most patients who want faster recovery time and they want to avoid the side effects of medication or surgery. So, super important to visit an experienced provider, whether you're seeing a chiropractor or you're seeing someone else. You just need to know that they've done this and they've done this many times before and have helped many people with it over the years. And we've seen tons of them, over the years. So, what are some of the best natural treatments for disc issues? So, movement therapy, that's one. Several movement therapy techniques that are utilized oftentimes by a lot of chiropractors provide relief from disc issues. These methods include things like corrective movement reeducation, massage therapy, neuromuscular electrical stimulation, spinal decompression, spinal rehabilitation, postural correction, and so many more. And we utilize a lot of those in our office. Chiropractic adjustments. Chiropractic adjustments have been shown by the research to just provide proper alignment, but also eliminate irritation and aggravation on the nerve where the disc is actually irritating that nerve. So, super effective. Again, seen this time and time again. Functional disc rehydration therapy may be new to you, but something we utilize all the time. Flattened, desiccated, or bulging discs may return to some level of proper functionality by promoting and restoring hydration. Loss of spinal fluids has been known to cause problems associated with spinal disc degeneration and other disc problems. Functional disc rehydration therapy ensures that the spine is decompressed and allows for the free flow of nutrients into the starved disc. And discs do require nutrients and water. Bulging discs are restored somewhat to their proper shape. When a spinal disc is restored and rehydrated, it can effectively provide shock absorption and cushioning between the spinal vertebrae. Disc rehydration ensures that movement becomes more fluid. Back pain associated with the disc is relieved and may be eliminated through proper disc rehydration therapy. Exercise programs is another one. Patients with disc problems are advised to carry out stretching and other forms of strengthening exercises to build strength and provide adequate support to the spine. The idea behind this is to keep the body in shape and ensure muscle flexibility. So the primary focus of your workout should be things, if you're having disc issues, should be low impact activities like swimming, body weight movements and exercises. And you can even do, cardiovascular. You just have to find the thing that you actually can do and do that on a regular basis. Acupuncture. Research has shown that acupuncture is an effective pain relieving tool, which helps the body release things like endorphins. Basically, those are natural painkillers. And herbal and vitamin supplements as well. Fish oil and vitamin D can be and are super effective at reducing inflammation, and you need them both together. The intake of proper diet and certain supplements may help provide relief from back pain associated with the disc when combined with other natural treatment methods. Patients, I would say, definitely discuss this with your chiropractor, with your nutritionist before taking supplements. Just make sure you're taking the right ones. So changes in certain areas of your lifestyle can help you recover from the symptoms associated with a disc issue. Practicing proper lifting techniques and good posture should be encouraged. You should also try to maintain a healthy weight, like we talked about before, and learn how to manage stress, because that also will help lower the inflammatory response as well. Avoid being sedentary for long hours at a time without taking out time to stretch or move. So these lifestyle changes combined with the natural treatment options for lasting and faster recovery for a disc problem are essential. And I would say that I'm a big fan of stacking therapies, if you will, or stacking habits. So the more of these things that you do that are positive, the more likely you are to move in the right direction. There's never going to be one thing that is going to be a home run most of the time. And if it is, great. However, more often than not, we need to do one, two, or more of these. And some of you out there may need to do all of them and even more that aren't on our list today. And there are certainly many, many more out there. I would just encourage you to just keep going. And keep working until you get the desired outcome that you're going for. So, again, this is Dr. Jason Jones signing out for Health Made Easy. We'll see you guys on the very next podcast. Have a healthy week. Bye-bye.